research shows up to 20% of excess total body weight can be lost being on this medication in a good cohort of patients. Hi, my name is Siva Gounder. I'm a bariatric surgeon based in Perth, Western Australia. I would like to talk to you today about medical treatment for obesity and overweight. As you know, there's been a lot of media coverage and a lot of chatter about medical treatment for weight loss. Medical treatment for weight loss is not new. It has been around for many, many years. It has evolved just like how surgery has to various different types of treatment. Initial ones were tablets that reduced absorption, such as orlistat, and then there's tablets that decreased your appetite, such as Germine, and now more commonly we are or newer medication, what we call GLP-1 agonists, or drugs that mimic some of the gut satiety hormones, and they help to reduce one's weight. So these drugs initially were meant for diabetic patients, and we've noticed that it's quite effective for weight loss as well. And newer versions are being developed to treat obesity by itself. The more common ones nowadays are some drugs like Ozempic and Mounjaro. The one of the Ozempic that's designed for weight loss is called Wegovy. The injections are usually once a week, and it's given in an incremental dose. They provide effect mainly by reducing your hunger drive and also increasing one's satiety. They are quite effective. 70 to 80% of patients will find some benefit from it. The research shows up to 20% of excess total body weight can be lost being on this medication in a good cohort of patients. In saying that, about 20 to 30% of people will not be able to tolerate the medication. It does have some side effects, mainly a sense of bloating, vomiting, cramping, abdominal pains, occasionally even diarrhea-like symptoms. And for patients who it doesn't work, you will know fairly early on that it doesn't work for you, and there's really not much point in trying to persist beyond that initial phase. Doses are incrementally increased, so you start at the lowest possible dose, and every month it's increased up to a maximum dosage. Usually takes about 3 to 4 months before you get onto the maximum dosage. These medications are effective as part of a team. It is not a single standalone treatment. You need to have a multidisciplinary or multi-pronged approach to ensure that these drugs are effective long term. They will help in controlling a lot of the weight-related problems such as diabetes, sleep apnea, and fatty liver disease with decreasing weight loss. What are the cons of injections and weight loss medication? Well, one thing is it is effective as long as you're using it. If you stop using the medication, there's the evidence showing that almost up to 2/3 of people will regain their weight within a year. Hence, the lifestyle change that comes along with the surgery is important. So when you reach your weight goal, then even if you stop the medication, you are able to implement those lifestyle changes. And the other important thing is cost. The medications are not cheap. In Australia, the starting cost is around over $100, and at the maximum dose, it can be close to $500 a month. And this adds up quite quickly over a span of 1 to 2 years. Hence, before deciding on the treatment options, you need to consider all of these things, and then especially approach a person or team or a practice that actually offers all different types of options, including surgical and medical management, in order to ensure that you have the best chance of success.